When you deal with patients who, on top of presenting injuries, experiencing domestic violence, psychological trauma, and distress, what are some resources or frameworks that are used to ensure patients receive the care that they need?
Domestic violence is clearly a big deal. It's a big issue. It's a big issue nationally. It's also a big issue for us, and that's a perfect example of, like what I was talking about before. If you have an unsecure firearm in a situation where there's potential domestic violence, like that incident maybe would not have started out with a gun, but because there's an unsecure weapon fully loaded sitting there, things escalate very quickly. So those are the kinds of things we focus a lot on in the prevention setting, making sure those guns are not easily accessible, making sure they're secure, making sure they're not loaded, those kinds of things. And then also all of the things related to domestic violence. So making sure people understand the risk factors, know where they can go for help, ahead of time before they get injured, try to get out of the situations that they're in to the extent that they can. I'm not an expert in that, but I definitely work with people who are experts in this who can definitely provide services and advice and counseling and things like that. So we try and hook people up early before they get injured.